The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between.
Dear listeners, most of the time, I don't start this podcast with an editorial. However, I feel that this episode is so important that one is needed. Today, we're joined by Sim Coutier from Kindred to discuss something fundamental to our practice yet often overlooked: constructive conversations. In pediatrics, our interactions shape not just medical outcomes, but relationships with children and families that may last for years. For truly constructive conversations, both parties must respect each other, be genuinely interested in building a healthy relationship, and share a deep underlying value. For us in pediatrics, that shared value is evidence-based medicine and the best possible outcome for the child. When this foundation doesn't exist, the conversation becomes merely transactional. Sign the sports form so Johnny can play soccer today, or write me an excuse so Amy doesn't have to take her algebra exam today, with the unspoken, and here are your $25. As physicians, we've been trained to teach, correct, persuade, and solve, but today's discussion challenges us to step outside this familiar framework. With Sim, we'll explore the power of curious questions, active listening, and what happens when we resist the urge to immediately provide answers. This conversation has transformed my own practice, and I believe it will offer valuable insights for yours as well. So without further delay, let's welcome Sim Coutier from Kindred to discuss the art and science of constructive conversations in pediatric care.
Hey, George, it's another Tuesday, this time in the afternoon, and we have one of my favorite guests and someone I enjoy listening to in conferences. Today, we're going to have Sim, who's a communication skill trainer, writer, broadcaster, and keynote speaker, co-founder of training company Kindred Skills, which helps people communicate, collaborate, and connect. Sim and I met about 2 years ago in Dallas when he was educating physicians on how to educate other doctors on preventing DKA through early autoantibody screening and the power of storytelling. And we had the great pleasure catching up in Detroit early in March. And we thought he should come back for 2 episodes. One, the Art of Constructive Conversations, which is very important in this day and age and time. So welcome, Sim. It's always a pleasure to see you.
It's so nice to be back with you, Herb. And hello, George. We weren't together last time we were on this podcast. You obviously had something far more important to do. No offense was taken by me. It was fine.
Yeah, I don't remember, but I had some rough times.
We had a better, I think he was in Italy or something. I think we had a better co-host, Sabrina.
Oh,
That's right. We did. Yeah.
Sabrina.
definitely better looking.
Yeah.
Oh, yeah.
When you sparked up the Zoom just now, I thought Sabrina had been through some hard times, and then I realized it was George. I was looking at it.
I mean, fine. Okay, let's rag on her, not me.
Sim, how was your trip to Detroit?
Oh, yeah, it was great. And I love working at medical conferences. It's most of the work that we do at Kindred is in healthcare. And the medical conference environment is a joy for me because you've got an audience full of people who are intrinsically curious. I don't think you become a scientist unless you're born curious. So even though they might be at the absolute top of their field in whatever their treatment area is, people are always pretty open-minded about communication, any thoughts on storytelling, how to connect with people. So I always find it's such an engaged audience at those things. So it was a joy. And it was nice to see Detroit. That's the only time in my life I've been to Motor City. So away from the conference, I stole a free morning to go to the Motown Museum, which is the original studios that they recorded so many of those classic albums in. So big tick from me for Detroit. Loved it.
Well, of course, I didn't see anything but the airport and the hotel.
Typical. That's a typical medical conference, isn't it? Airport, hotel, airport, home. Yeah.
And how's your daughter doing? How's she progressing in her medical studies?
Thank you for asking. She's doing really well, thanks. My eldest of three daughters, Ella, is, postdoc medical student and in her second year at Warwick University. So she's working at Warwick Hospital mainly, but in scattered hospitals around the middle of England. She's on in the UK. If you're in your second year as a medical student, you're out and about, you're hands-on, but obviously they don't give you any sort of sharp things to poke at people yet. It's mainly just lots of placements, watching, and she's doing that thing at the moment where she's a few weeks here, a few weeks there, quite scattered. I think she's finding it a little frustrating. She would rather stay somewhere a bit longer. But she's just done psych, which she did not enjoy. But she's about to do pediatrics. So I thought I'd mention it, given where we are on this podcast. So she's going to do her pediatric first sort of experience, her first placement in a couple of weeks.
Will that be in a hospital or in an outpatient setting?
That'll be at a hospital, yeah. Most of it's based in either Coventry Hospital or Warwick Hospital, yeah.
Oh, wow. Is she still passionate? Does she feel like she's in the right place?
Yeah, she definitely feels like she's in the right place. She's keen to get on with it, I think.
Yeah,
she's
it's
sort of
very frustrating.
chomping at the bit, yeah.
Yeah, what I find most students are very passionate about what they do, especially when they go into their clinical years, because they don't have to read those anatomy questions and do those, sit down and have somebody lecture to you. They enjoy the most is just hands-on, go in a room and speak to somebody.
Yeah, exactly. And that's her preferred way of learning as well. She's finds it much, much more engaging to be in an environment where you're seeing, doing, asking, rather than just be lectured at.
But the very interesting thing that I find with medical students is when they first start out, they're afraid. And the next step is they run to the computer and they start typing because they're good at that. And then I walk in, I said, forget about the computer, talk to the people. They find that very weird.
Yeah. It links to what we're talking about today, rather than
exactly. That's what I was thinking about.
Yeah,
this is the new generation.
But they got to be stopped.
Computer native.
Yeah,
I don't think this new generation knows a day without a smartphone.
Yeah,
it's part of their life since they've been 10 or so. So it's a very different generation.
Correct.
Sim, let's try to define what a constructive conversation is.
Yeah, sure. So for those who don't know me and why would you? Didn't listen to the last time I was on here. My background is as a broadcaster and a writer. Started as a BBC radio presenter. Did that for about 3 decades. And along the way was a TV presenter and then a writer for television and a writer of stories in books and things. And really, it's the sitting opposite someone and interviewing them, which I've done with over 10,000 human beings over my career, is literally about the art of conversation. It's about how do you get the maximum amount of understanding from a person in the shortest amount of time. And it so appears that the tools that are used by journalists and interviewers, talk show hosts, therapists and counselors, we can actually apply in our professional lives. So we do quite a bit of work at Kindred in pharmaceutical companies, helping scientists have conversations with either with other scientists or with patients or internally within their organization, helping them have those constructive conversations. So that involves all sorts of elements of objection handling, pushback. How do you deal with differences of opinion? Seek to understand the other person. How do you do that so you don't just have surface level conversations? They actually have depth. So I suppose that's a long answer to your question. I suppose the short answer is the art of conversation is really the art of understanding. It's the art of putting the other person at ease and demonstrating to them that you want to fully understand their thoughts.
Great. And when can constructive conversation happen? Because I don't think it can happen every time you want to have a constructive conversation.
Yeah, that's a really good question. I suppose in your world, in the world of physicians, you don't have time a lot of the time to really dig in and have those moments of depth. Or certainly time is a challenge. So it's a good observation that some of the skills that I'm going to talk to you about today are the kind of skills that are perfect to use when you really need to focus on the other person. I'm not saying you have to use these skills every time you have a transaction with somebody, because in your world, you'll have transactional conversations where literally someone will go, where's the such and such? And you just need to go, it's over there. Can you bring me the such and such? And that's a conversation, but it's an entirely transactional, logic-based conversation. We're not seeking to understand anyone's feelings or emotions. I think knowing its place, reading the room, is definitely a big part of it, isn't it? Understanding when you need to be sensitive to someone else. So that's typically patients and patients' families.
I think your key word there is constructive. And I don't see it so much, although yes, most physicians around the world are pressed for time and are distracted by a computer that doesn't improve quality, doesn't improve the quality of the relationship with the patient. But I think there's limits to the time, so certain things where you can no longer have a conversation. So in the extreme, if I was to sit down in England at a pub and somebody sits next to me and they order a pint and they tell me how they're neo-Nazis, is that what kind of any conversation, constructive or not, can happen with someone that has that belief from my perspective. I'm not going to change his mind. I don't want to hear his views.
It's an extreme example, but it does highlight what's at the heart of a good conversation, which is curiosity. So my question to you immediately in that situation would be, are you curious?
No, not about a neo-Nazi.
So you've demonstrated really nicely for me. It's a very extreme example, but you've demonstrated really nicely for me one of the most common challenges people have with constructive conversations, which is if somebody comes to us with an opposing opinion, something we feel is entirely wrong. Somebody comes up to you and says the earth is flat. What most of us do in that situation is either choose not to engage, which is what you've just demonstrated, or try to prove them wrong, try to correct them. Neither of those are going to build a relationship. Neither of those are going to get the other person to actually open up and be open-minded themselves. You're just going to get entrenched on two sides of this chasm between you. The constructive conversationalist will meet that person and rather than judge, rather than correct or teach, they will be curious and they will ask them questions. Tell me more about that. Where does that come from? I need to understand it. There's a really fantastic TED Talk that I go to use clips when I'm training people in these skills by a woman called Julia Dahl, who's an Australian. She was a brilliant debate winner. She was like a world-class debater. She did it at university and then won loads of competitions. And now she earns a living helping governments and senior corporations have difficult conversations, basically. And she has this great phrase that she said in one of her TED Talks, which is a good example of your neo-Nazi in a bar thing, where if you're ever having a conversation with someone who you absolutely intrinsically disagree with, and you are convinced that they are utterly wrong in their opinion of something, you only need to remember one sentence and one question, which is, I never thought about it that way before. What can you share with me that will help me see what? So if somebody were to come to you and go, the earth is flat, rather than tell them they're nuts or they are wrong for the following reasons and challenge them on that, the first thing you should do is go, that's really fascinating. I've never, ever thought about it like that. What can you share with me that will help me see what you're seeing?
Yeah, we get this conversation or some version of it with vaccinations. I don't want to give my child an MMR vaccine because I think it causes autism. Common event.
And now tell me what your response to that would be. So if a parent said that to you, what's your response?
I usually, go ahead, Herb, you start with.
Sorry, I have to interrupt, but just a level set. Measles is a severe disease. It's one of the most contagious diseases known to mankind. Before the vaccine, when the U.S. population was only 170 million, not 350, we saw 500,000 cases of measles a year, of which 20% or 100,000 ended up in the hospital, and it has a mortality rate of 1 in 1,000. And the vaccine has been out since 1953. And so every year, just in the US, I don't know globally, I don't know in the UK, but there's about 3 million kids who are 1 year old and 3 million kids who are 4-year-olds. So every year since 1953, 6 million kids have been vaccinated. And rarely, right now we have an outbreak, but rarely do we see measles, and rarely do we see ill effects from the vaccine. It's not like any intervention. You may get ITP, you may get a rash. However, the benefits far outweigh the risk, and it has been studied for, we're in 2025, so 75 years. So
is that your response?
No, I'm just telling you that's what that's
For most people would
standard
say.
of care.
Yeah,
That's where we're level setting.
yeah.
So now you have someone coming into the exam room telling you, I watch YouTube videos and TikTok videos, and I'm doing my research because MMR causes autism. Okay, what do I do with that?
What you
I
definitely
told you the facts, right?
Yeah. What you definitely don't do is everything that you just said. Like, your instinct is to present them with all the data that proves they're wrong. The common traps that people fall into when they're trying to build a trusting relationship with another person through a conversation is they hear something from the person opposite them, and this is classic for physicians. They either correct, teach, solve, or persuade.
I have an easier methodology because I share a personal experience. Not that I saw a lot of patients with measles, which I did. I was actually a patient of measles as an intern in New Jersey. And I tell them my story, how I worked in the emergency room, how we admitted 5-6 cases of measles a night, and how these children presented and how sick they got, and how Dr. Rogu got it as an intern and passed out and was hospitalized for 2 weeks, and it was not fun. That usually sells it, but that's a personal experience. But I think you're going to be going that personal experiences are a good story to tell.
Yeah, you're trying to solve. Here's what I'm not being able to communicate to you is that for me personally, other people are different, right? There are things that are deal killers in a conversation. If you tell me that you're a neo-Nazi, that's it. I've lost interest in the conversation. I don't want to be seen with you. I don't want to be friends with you. I am not going to try to persuade you. I respect your right to think however you want and to live your life however you want. And at least in the US, you have the right of free speech. You can say whatever you want to say.
Less now than ever.
Yes, I don't want to be complicit in that thought that Jews should be exterminated. I don't want to be complicit. And I know it's a very rigid position, but I feel very much deeply that is my choice as a human being not to be associated with evil.
It's absolutely your right to walk away from somebody who you don't want to engage with.
Okay.
If I could just, could I just take it back to the
we will, because I need to
vaccine?
tell you again. So when you, parent X, tells me that you're going to do your research on MMR, when there's people that are like 10 to 50 times smarter than I am, who have researched this up and down, and there is no association between the MMR vaccine and autism. And I am responsible for the care of that child. And if that child, for whatever crazy reason, gets measles and dies from measles, it is on my watch. I don't have a relationship with you at that point. To me, this is a terrible example, another extreme example. But if I was dating a beautiful woman, I'm divorced, so I'm not allowed to date. And she said, I love you, Herb. You're a super cool guy. I really like you. I like to move into your house. I'll pay half the bills and everything's going great. Oh, but by the way, I don't believe in monogamy. Let's have a conversation that I want to have a girlfriend and a boyfriend on the side. It won't interfere with our relationship.
It's called friends with benefits.
Well, I don't want
Pays
them in my
first.
life. I'm not judging her. It's not judgment. For me, that doesn't work. For whatever reason that makes you feel that you want that in your life, go for it. Be happy. Love you. But I couldn't deal with that. I don't want to deal with that. And I'm going to walk away from that. So there's no relationship. So if there's no relationship, it's very difficult to have a constructive conversation.
If I can give you some thoughts on this.
Yes, that's why I invited you. This is perplexing to us.
For the avoidance of confusion, let's stick with one example at a time. Let's go with the vaccine example. I've just done a training session with a German pharmaceutical company who are having exactly this problem, recruiting parents of babies for a study, because the parents typically don't want their newborn babies to have needles jabbed in them. And the pushback of a parent saying, I don't think this is safe. This actually involves the COVID vaccine. And I've heard the COVID vaccine isn't safe. And what you've done when you just did your little example, George, of a response to that by explaining all the facts, is typically what's stopping them recruiting people. So the recruitment isn't working because the clinicians or the study coordinators' response to that pushback is to show them why they're wrong, which is correct. I'm going to correct you on that. You're wrong on that. Let me teach you about this. And people will sit there in body language terms, we call it unusual stillness. This is where if you find the person opposite you is just unusually still, for those of you watching this rather than listening, it looks like this. You are not connecting with that human being, because when someone's connecting with you, they nod along, they make good eye contact, and they keep on nodding along. When people drop into unusual stillness, it's normally because you are talking at them and they don't feel heard. So if a patient or a patient's family comes to you and says, I'm worried about the measles vaccine, I've heard that MMR can cause autism. Because you're a physician and that's not true, your instinct will be to tell them why they're wrong and say, look at the numbers, look how many millions have had it. How could you possibly think that? That's crazy. But from their side, unusual stillness. All they hear is a person failing to listen to them and burning time with something they don't believe. Like, you haven't changed minds, you haven't won hearts, you're not influencing them. So the correct approach to that is rather, and I'll get to the moment when you can teach and solve, because you will get to do that, by the way, but you just don't do it instinctively at the start. You'll want to, but you need to check yourself. You need to stop yourself from doing that. If you find yourself doing all the talking, you need to go, in your brain, wait, which stands for why am I talking? Just wait. You need to ask them more questions. You need to show that person that you want to understand where that thought has come from. You may think to yourself, I bet they've been looking at TikTok. I bet they've been on Facebook. But don't assume, ask. So you need to say to them, oh, I'm sorry to hear that. Tell me a little bit more about what you've heard.
No,
Yeah,
I
that
was
could be.
actually told in the exam room that I should educate myself by watching YouTube videos and TikTok videos.
Yeah, you absolutely could. But
No,
in the moment of...
If your doctor says he learns his medicine watching TikTok videos, you should do well served to find another doctor.
Yes.
If you want to watch the TikTok videos that they've watched, though, that's what I thought you meant, so that you can see what they're seeing, then why not? You might as well make yourself educated in the world they're in, because what this moment of the conversation does, and this is how it turns into a constructive conversation, is it shows the other person that you're keen to understand their thoughts. So you can ask them, tell me more about that. Where's that come from? What have you heard? When you feel like you've properly understood where it's come from, you will probably want to show them that actually that's not true. And the technique here to keep them on side and to keep them open-minded to what you're about to say is not to tell them, but to ask them. So when you get to the point in the conversation where you're like, I am itching to show you why you're wrong, you propose it as a question. So in the same way we propose marriage, you don't ever get down on one knee, thrust the ring into the air and say, you will marry me. We ask a question, we propose it, and you propose whatever your solution is that you're dying to tell them about. In Herb's case, the millions of people who've had the vaccine, and absolutely it's been researched and it's absolutely safe. But rather than just telling them that, you would ask a question. So you would say something like, I'm really keen to understand your concerns. Tell me more about what you've heard and how's that affecting your decision making? What effect do you think not having this vaccine might have? Talk to me about the impact of your choices. Okay, now I've understood all of that. Would it help if I told you why we think it's absolutely safe? Can I share something with you on that? And you're giving them the opportunity to go, no. And that's important. They need to have the opportunity to go, no, and that's fine. If they're going to go, no, okay, then it just feels like you ask another question. So at that point you go, tell me a little bit more about what the reticence is there. So you can just keep asking questions. 99% of the time, they won't say no. They'll say, yeah, sure. At which point you can go, okay, so here's the facts, da-da-da. And then when you get to the end of your bit of evidence, you check in. And you go, so now you've heard that. And again, you do it neutrally. So you would not do it as a leading question where you would say, so that's pretty convincing, isn't it? Which is a leading question. You would say, so now you've heard all that, what are your thoughts? Which is neutral.
Yeah, it used to be in the old days, you used to be able to have a conversation back and forth. Now that's it. Talk to the hand. No.
I think all these techniques are wonderful. And then we'll move on to another example. Because the measles is a very difficult one.
Uh-huh.
Currently, in the exam room, the lack of conversation, there's no conversation that goes on with the COVID vaccine, the influenza vaccine, and the measles vaccine. It's, you come in, you go, you're 12 months. At 12 months, we give the measles vaccine. Do you have any questions or concerns? I don't want it. We recommended, the American Academy of Pediatrics recommended, I live in Virginia, the Commonwealth of Virginia mandates it before you start school.
Okay, pause the podcast.
Wait,
pause. You've just done the thing you shouldn't do.
Okay, but listen,
It's reality.
but this is the reality. So I'm going to give you.
So someone says, I don't want it. And your response is to tell them all the reasons they should have it.
Wait, what's in? So I said, okay, so the next visit is at 15 months. Go think about it, and then we'll come back and we'll revisit.
Aren't you curious as to why they don't want it?
Not really at this point, Sim.
They usually don't know why they want it.
See that also, some are valid. Some people go, COVID in a kid is a cold. Why would I put a chemical in my kid if they're only going to get a cold? And that's totally reasonable. And I look at them and I go, you're right. What am I going to do? You're right. Don't get the COVID vaccine. And someone else might say, and George will disagree from this because his father died after contracting influenza in the hospital. But influenza is a pretty weak vaccine. It prevents 50% of severe disease in a good year. And so if the parent says, I don't think there's much benefit to the influenza vaccine, 50-50, that's like flipping a coin.
Oh,
I'm like,
reduce influenza in the community. That kid wouldn't be spreading it to the other kid that spread it to my father and killed him. You got to look at it that way.
I understand, but I also understand the parent saying it's 50-50. It's a healthy child. You're going to shoot them up with something, that everything that you shoot a kid up with, whatever it is, even Tylenol or Motrin, acetaminophen, paracetamol, I think they call it in England. The most benign medications, they all have side effects. So I am like, okay, yeah, okay, all right. I understand where you're coming from. You don't think that the benefit outweighs the risk for your kid getting an influenza vaccine.
If you're trying to persuade somebody,
let's hope it works well for you, because that's not a hill I want to die on. But measles is one that I do feel very strongly about, and I think it's the parents making a wrong decision. And because my patient is a kid, not the parent, I'm trying to get a third party to do what's right for the patient.
That's what I'm interested in. You're trying to persuade somebody. That's what you're doing in that conversation. You're in that moment, you're trying to persuade a third party, as you describe them, to make a choice. And if you want to convince someone to change their mind, there's been a ton of psychological research on this. If you demonstrate to them that you are open-minded about their viewpoint, they are massively more likely to become curious about yours. Whereas if your first response is an absolute lack of curiosity and just to tell them why they're wrong, they will never be open-minded to hearing your side of it, because you've not demonstrated that you are at all. And that's basic psychology. So if your goal is to persuade a parent of a change of mind, you absolutely need to demonstrate that you are curious about their state of mind. In doing that, they will become curious about what you've got to say.
I don't know. That's a tough one, Herb.
I think
the best we can. We talk to people. We try to convince them to take a vaccine. If they get a vaccine, fantastic. If they don't, I guess it's on them and they won't go to school.
I think you're right, Sim. I think you're right. I think that many times if you just shut up and listen for a little bit, you can get to understand where the other person's coming from.
Yeah, that's the sort of simple way of putting it.
But there's also sometimes where the other person's point of view is so set. Mine is totally set. I don't believe that not vaccinating for the MMR is good parenting. You're not going to persuade me otherwise. You're not going to bring any information to the table that tells me that the MMR causes autism or is an unsafe vaccine or it needs further studies like Bobby Kennedy says it does. You're not going to persuade me. You can ask me, you can use whatever psychological trick you want on me. That's not going to change.
Of course. Now, given that you know the facts and that you're not going to change your mind on this,
yes,
does that preclude you from understanding another person's point of view.
No, but my point is, if we have a difference of opinion that's this strong on your side and my side,
It's
and
okay. It's okay to have opposite views. You
and
can still have a constructive conversation
and this
and
is
have
very
opposite
important for
views.
both of us. And medicine is based on a relationship, and we
That
can't communicate,
exactly.
and we are not communicating effectively on this very important issue.
If you want the
Your
person you're
child is
talking
really
to
better served by seeing a pediatrician that doesn't vaccinate and holds your views. I don't have to agree with it, but that is your heartfelt view. And you're entitled to that view as a parent, and you have choices. I don't have to obligate you to do anything. But at the end of the day, if we don't communicate, we don't share common ground such that we can have a strong relationship so that we can take care of your child, you, the parent, and me, I give you advice and you do the work. Then you're better served by someone else that has the capability, the ability, the empathy, the time, whatever it is, to be able to meet you where you're at. You don't want to give vaccines. And that's totally okay.
Yeah.
That's our constructive conversation. We don't agree. I'm not going to persuade you. You're not going to persuade me. This is not a fight. It's not personal. It's not judgment. It's what's best for your child. What's best for your child is that you have a relationship with their pediatrician that you enjoy and that you communicate so you can do what's best for your son.
Yeah. Unfortunately,
that's not occurring in this moment.
Yeah. Unfortunately, there's also medical liability in our conversation, because I can tell you that if somebody gets the measles and they get sick, they'll go to Dr. Bravo. If you would have told me more, I would have given the kid shots, obviously.
And there's several lawsuits.
Bravo's not going to write all that note. I actually had a case with the flu where the kid got the flu, got sick, ended up in the hospital, secondary infections, all that kind of stuff. And the mother says, I don't understand why the doctors didn't tell my kid to get the flu shot. And I looked at the chart of the checkup. Fortunately, we had the medical AI scribing that every piece of the conversation was written down. And it clearly stated the physician wanted you to get the vaccine. You refuse to get the vaccine because you feel it's not necessary. That ended the conversation right there. But ordinarily, you would not. I mean, some people would, but it's hard to write all that stuff down.
And I'm not saying that by being curious about the other person, you won't get to tell them this stuff. Of course you will. You just, if you want this to be, look, we set off this whole podcast by me saying some conversations are just transactional. If a person comes to you and goes, what's your advice? You're allowed to go, they should get the vaccine because all the evidence shows it's the safest thing to do. That's a completely transactional conversation. What we're talking about is where you need to build a relationship with somebody because you need them on side to make good decisions on behalf of a child. And if they've got an opposing view to you, there's a route through that conversation that builds trust rather than erodes trust. And it's
so now you hit the nail on the head. So there are transactional conversations. And right now in the US, I don't know how it's in the UK, but right now in the US, when it comes to vaccines, the conversations are transactional. This is the schedule. This is what the government recommends. This is what in the US is what the state mandates for you to go to public schooling. This is what I think. So in the US, COVID and influenza are not mandated in most states to go to public schooling. And that's what you're asking for my opinion. I'd rather you get the flu vaccine, but if you don't get the flu vaccine, what are we going to do? That's not going to ruin our relationship. We'll talk about it next year again. Okay. But the conversations are very transactional. It's not even, would you like to get the flu vaccine? No. Talk to my hand. The palm goes up, no. And when you do that, and you and I had this conversation, which is, I shouldn't say it on the podcast, but I'm going to say it, which is made my stomach sick. That interaction between President Trump and President Zelensky in the Oval Office, when President Trump raised his hand and said like this to him and said, "You don't hold any cards." That is the worst thing you can do when you're communicating with another human being. That is a terrible example of leadership. I don't care what the outcome is. The war could end. There could be peace all over the earth. It's just terrible communication. But when you're on the other side of that, no, there's no door to go through.
What's stopping you asking why?
I just don't want it. My friend said so. I know better. It's my kid.
Yeah, and that's we assume.
No, that's
No,
what they
no,
say.
this is
That's
what
what
they
they
tell
say.
you. And then it escalates. We just had
It
a friend.
escalates, yeah.
We had a friend who the father started screaming at her. She's a
So,
female
okay.
pediatrician. And then she told them, screaming in the office, that she was a baby killer. She was going to kill her kid by giving him the MMR.
Yeah.
So
I told them,
it's
a
what I'm
mother,
hearing.
I told the mom not to give the measles vaccine. And she told me I was a racist for recommending it.
So I asked you what's stopping you asking why, and you both gave me examples of answers you would get. But really, that's not an answer to my question. You've given me examples of what you typically would get back, but that's not an answer to my question. My question is, what's stopping you asking why?
I don't know about you, Sam, but if someone called you a racist after you asked them to do what standard of care,
Give you a headache.
So is it fear? It's a fear of what you'll get back. You don't ask why because you don't want to hear what you'll get back in case they call you names.
that's
Is that
part
what
of it.
stopped?
But you already called me a name. I don't want to have any
Yeah.
more conversation with you. The conversation's over.
So you've made a big assumption there.
You told me I'm a baby killer.
This is when we do conversation training. We flag this up and we go, hypothesis is good, assumption is bad. And they feel like the same thing in your brain. So you need to be really good at distinguishing. Hypothesis is great. So if somebody puts their hand up to you and says, I just don't want it, your brain hypothesis is coming up with a million reasons why you think that might be. But we don't want to assume. We need to check. And if you say, oh, tell me a bit more about that. Why don't you want it? And they start ranting at you about whatever your worst example is, then you've proved a hypothesis, and that's okay. And that can be the end of the conversation, but at least you asked. At least you asked. And what have you burned? 8 seconds of your life. Big wow. But you know what? That person will feel like, okay, maybe this person's curious about me. Maybe I'll be a bit more curious about what they've got to say about this.
It's possible. I like your approach. I like your approach.
Constructive conversations are about building the moment, building the relationship so that people on both sides become open-minded about each other.
So that's why I started by asking you, when can they happen? Because I think
when can't they happen?
When can or when they can't.
Yeah.
I think that for construction relationship conversations to happen, both parties have to be willing to further the relationship and understand where the other person is coming from with respect. You might still disagree.
Yeah. And you might get into a conversation where you might not change their mind, in which case that's okay. But as long as you've understood it.
Yeah, but I still don't want to give my kid the measles vaccine.
Yeah. And that's just a statement. That's not an answer, is it? You could still ask, tell me why. Tell me a bit more about where that's coming from.
Already heard what you said. I'm not convinced.
So tell me what you would need to hear. What would convince you?
I already know that you guys are just pushing these vaccines for profit for the pharma industry.
Where do you get that from?
TikTok.
Tell me about the TikToks you've seen.
Oh, I'm not on TikTok, but that's where the conversation ends.
But that's how it goes from my side. So you keep coming back with these short answers about why you're not doing it, but I can just keep asking curious, open questions. Tell me more. Tell me what you've seen. Tell me where that's coming from. So just so I understand it. And when you think you've dug enough and you're not going to, it's like, I've got no hope of changing this person's mind. It's fine to go, okay, cool. Thanks for sharing that with me. It's completely up to you. It's not what we would recommend, but I get it. It seems like you're pretty decided. And then you move on with your day.
But we agree with that. I just get there quicker.
But you get there quicker at the cost of not building any trust with that person.
I don't want that. I don't want that mother as my client. To me,
that's different. You got me on here to talk about constructive conversations. Now you're talking about somebody you don't want to have in your clinic. That's a different conversation.
To me, someone that I cannot have a respectful, constructive conversation with about an issue, and it degrades into name calling on their side, is a very difficult client, one that is going to take up a lot of bandwidth, which I can use to take care of the kids.
Yeah.
And George says, at some point, because they're already unreasonable and angry, they're going to make the wrong choice, and then they're going to blame me because I didn't do this or that.
Oh, yeah, guaranteed.
We see it all over. Some pediatricians getting sued because a teen developed cervical cancer and the parents refused the HPV vaccine. So to me, it's a flag of this is not a good relationship, and it's standing on the abusive side, and it's not good for my team. It's not good for other parents. It's not good for the care I want to give to other kids. And it would be serve everybody better if they find someone that doesn't like to vaccinate. Move on. Day's too short to suffer. So that's why was my question of what needs to happen for a constructive conversation to happen. Both parties have to come at it, as you're saying, with an open mind and respect to each other, and agree to disagree. And the outcome may be no one changes their minds. They just agree to disagree, and we can continue the relationship with a minor disagreement, or this is a deal killer for the relationship because we both feel strongly. And that's an okay outcome. Right? That's an okay outcome. Nobody should feel like their feelings are hurt over that. And that's why I was asking you, when can it happen? I don't think it can.
I think it can. You're not in the other person's head. So I don't think you should go into every conversation, every transaction that happens in your day thinking, there's no point me having a conversation with this person.
I don't. But when it comes to the point, this is what I think.
You can allow yourself the 10 seconds it takes to be curious about their opinion. You can allow yourself that.
Most physicians do.
I don't disagree.
Physicians don't want to get into a hostile environment. And the truth of the matter is, the conversation is always the same. There's no dialogue. It's, I don't want it, talk to the hand. It's always like that.
Not always. There's people that have nuanced conversations, and okay, all right, let's see if we can agree on something.
I think you need to be clear on what you want from the conversation. If you don't want to win hearts and minds, you don't need to do any of this. Now, when we train people in constructive conversations, it's normally because they want to build a relationship with somebody. Often a stranger. We train MSLs to talk to KOLs and physicians, and they're in a position where it's, oh, I want to build a relationship with this person. Whereas some of the examples you're talking about, if you don't need to build a relationship with them, if you don't even want them in your clinic, why are we even talking about it? Just go, okay, fine, you're wrong. You can leave. Go and get another. Like, this is only relevant if what you want is to build a relationship with that person. If you don't want to do that, don't do this stuff.
Yeah.
Yeah. And I think, it depends on the circumstance, right? If it's something that's not dear to your heart, I mean, somebody asks you, is it okay if I tie my kid and beat him with a belt every time he doesn't eat his dinner?
It's called child abuse.
No, it's not okay. Why do you think that would be okay? because that's what my dad did to me. How did that make you feel? I'm fine. I turned out to be a lawyer. I don't know where you go from there in that conversation. So if
all of the same things apply, Herb. All of the same things apply. It's all about curiosity. Ask questions. Seek to understand before being understood. That's at the heart of all of this. So if somebody came to you and said, is it okay to do this? Rather than you just going, no, you can say no. But if you want to really understand them and build a relationship with them, you can seek to understand before being understood yourself, which is okay, which would be all of the questions. Tell me, explain, describe, impact, consequences, effect, all the kind of classic open questions. And then allow yourself to be understood, at which point you say, it's not okay. Here are the reasons why it's not okay.
all right, I'll try it.
We'll try it. Yeah.
I'll try it. I just think that what I'm trying to get to you is some conversations very transactional. Some you can tell that whatever you do is just not going to be received well. And you were like, okay, I had 20 kids to see every day.
Yeah.
I can help 18 of them. I got to let go of the one that I can't get tied down, bogged down on this circular argument.
And that must be hard. Yeah.
So
that's a challenge.
I got to do the best I can for the other kids.
Yeah. I get that.
This is not the only kid I'm going to see today.
Yeah.
But that's why I'm going back to, it takes two people to have a constructive conversation and respect. And you can still tell me as a parent, you don't like my advice. You're going to seek a second opinion. You think I'm wrong. I could be wrong. Let's find you someone else to take a look at and see what they think. It's totally okay. But respect and courtesy towards each other, because I'm blanking out the word, but ideally, we're both working towards the same goal, which is to make the best decision for your child, given what we know in this moment, because we've been wrong as scientists in the advice that we give humans more than once. But that was all we knew at that time. I can't do more. But it's very interesting because it's right now, it's a very emotional issue amongst pediatricians.
Yeah, I bet. Yeah.
That we're really getting hammered in the exam room. And in the US, I don't know what the political climate's in the UK, but in the US, on both sides, there is no interest of having construction conversations, governing or solving problems. It's just canceling people, insulting people, shaming people, and talking points. And that is permeating into the exam room.
You're seeing a change in people's attitudes, are you?
Oh, that change in people's attitude after COVID has been dreadful. And it's not allowing for what you're saying, a constructive conversation.
Yeah.
This is my point of view. What's your point of view? Where can we meet? Where can we meet? Or no, we can't agree. Okay, we can't agree. That's okay. Humans don't agree on everything. Is it a good time for you to find someone else that would maybe talk to you in a way that you would be persuaded to do what you need to do for your kid?
When you go into a conversation and you've got a point of view, if someone says, I don't believe this is the safe thing to do for my child, and you've got a point of view that you know is different to that, you can tell them that. You can say, I've got a different view on this, but first I want to understand yours a little more. Tell me more about that.
And I think
so you flagged it up. So they know you're going to go to a different point of view, but you've still demonstrated, I want to understand you first, because that's what good persuasive conversations do.
Yeah.
You need to seek to
I'll give you another
understand.
example of vaccines that weren't seen. I had never seen it before. the hepatitis B vaccine is a very safe and effective vaccine. And I am having more and more parents saying, I don't want it.
Why don't they want it?
I ask, why don't you want it? And they give me a very reasonable explanation. This is a sexually transmitted disease. My newborn is not having sex with anyone.
Uh-huh.
And they go, yes, that's right. However, it's also, you can also get it from saliva, a bite, just accidentally. And unfortunately, in the US, we've had 20 million immigrants that we don't know where they came from. They didn't go through the regular immigration process. Because when you're going to immigrate to the US, they test you for HIV, hepatitis B. They make sure your measles titers are what they're supposed to be so that you can be part of the community. You, I, Amy over there doesn't know when somebody from Eastern Europe, where they don't have the funds to test for hepatitis B, the mom, so the baby doesn't get it, and the child's in the nursery with your child and they bite him. And now you have hepatitis B, which leads to liver cancer. Now, how likely is that to happen? Maybe 1 in 5 million. So you're not being unreasonable. And if you don't really want it, don't give it. But that's a risk you're taking because we have a lot of unknowns. And anything that we do, if I give you the hepatitis vaccine, there could be a side effect. If I don't give it, your kid could get hepatitis B. There's no way of not having risk. So it comes down as a parent, this is my conversation with them. As a parent, what risk are you willing to tolerate? You tell me. And then if they say, okay, just give it, I go, no. Go home, talk to the child's mom or the child's dad, the other person that donated half the DNA to this baby. Sit down, have a conversation. Come back when you've made up your mind. Because if I give you the hepatitis B vaccine booster at 1 month, or I give it to you at 2 months, it doesn't make a difference. And you still come back and you tell me you don't want the hepatitis B vaccine, I'm okay with that vaccine. Don't give it. I'm not agreeing with you, but I can live with it. And we can build from that. But you come and tell me you're not going to give your kid polio vaccines, that one I have a much harder time finding anywhere to meet you. And that's the difficulty we're struggling right now as clinicians in the US dealing with that.
Yeah. In summary, it's not an argument. If you want to win people round, instead of proving them wrong, winning your argument, demonstrate to them that you want to understand them, and then ask permission to show them the thing you want to show them. So in that example, it would be, tell me more about that. Where has that come from? What have you heard? What impact is that having? All of those sort of questions. When you've understood facts and opinions from them, you ask permission and say, would it be useful if I told you why it's not just a sexually transmitted disease and why your baby is at risk? At which point they will go, yes, please, Dr. Bravo. And then you can tell them all that stuff. So it's a tiny change to the way you're having the conversation, but it's the difference between being like the lecturer wagging your finger at the naughty child and going, you're wrong and here's why you're wrong. You failed the test. You're stupid and I'm a really clever doctor. Or saying, we're partners in this to the benefit of the child. Let's work together and understand each other so we can make the right decision. It's a tiny change to the conversation, but that's the difference. That's how it'll feel different to the other person.
So let me ask you another example, which I think is easier. Okay. But I step on it all the time. So in the T1D space, when I'm speaking on behalf of Sanofi, why it's important to screen, to identify the kids that have insulin dependency. I am asked this question often, and I'm sure the MSLs are asked this question often. And it is, what will that do to the kids' disability and life insurance premiums? And obviously, because I'm a very black and white human being, my answer once, just like before I can even think, is children don't work. They can't get disability insurance.
They will in the future, and it will affect them negatively.
So that's the first thing that comes out of my mind. And we screen newborns in the US for cystic fibrosis, for sickle cell disease. And once they know that, whenever they go by, I don't think somebody with cystic fibrosis can find life insurance. And it's just, it is what it is. But I see your wisdom of pausing. And a particular example, that's why I wrote it for you in the show notes, was I was speaking to almost 150 pediatricians. And one pediatrician, she happened to be female, asked me that question. And I said, we screen for all kinds of things. And once you find out, there's no sugarcoating that. Yes, their disability and insurance premiums are going to be higher because they're going to be rated based on their risk. I don't know how to solve that one. But that's not a reason not to screen. But my tone and the speed of the delivery, as you're saying, was absolutely wrong. Because I no interest in understanding why she was asking the question. It's a question with no solution. So afterwards, I'll tell the story so you can, afterwards, I did what you tell me to do, right? Afterwards at dinner, I went over and I apologized to her. I said, my tone was all off. I just get asked that question a lot. And I don't have an easy answer. It is what it is. And so she told me where she was coming from. Her husband was diagnosed as an adult with D1D, and she has 2 adolescent boys. She didn't say this, but the fear is she knows the numbers. They have a 15-time higher risk than the population in general of at some point needing insulin. She has aversion, denial, doesn't want to know. And her question really is not about the life insurance or the disability, because I said, look, it's a fine question, but do you really think that Prudential life insurance isn't going to ask you if there's a family history of diabetes in your family and now flag you at a 15 times higher risk than the population in general? They are. And they're going to do, your premium is going to be based on that risk. And if anybody has AI and huge amount of data, is the insurance companies.
Yeah.
And if we know the science, you know the science because you're a pediatrician. If your child has 2 positive autoantibodies, within 10 years, 75% of them will need insulin. And the peak incidence is between 10 to 14 years of age. So if you test them at 2, and they develop, if you don't test them, but they develop insulin dependency at 10 or 14, you're probably not going to be able to get disability insurance.
So your story
But I
highlights...
didn't do the right thing, right? I didn't seek to understand her question first. And so I reflex responded.
So your story highlights 2 really key observations about good conversations. And we talk about this in our training all the time. The first is, it is not your job to solve it. This is really hard for physicians to get their head around. Your job is to understand it. You may have a solution, you may not, but you can't enact anything until you've properly understood the other person. So that's the first thing, because when that question comes up, your brain goes, I can't solve this, and bats it away with a whatever reply. Instead of going, I need to understand more about this. And the second thing that your story is a great exemplifier of, which is why good interviewers are good at their job, is you rarely get the truth on the first response. Most people require a follow-up question to actually reveal the truth. Now, if we take that surface level encounter you had with that woman, you assumed, you didn't even ask, you just assumed where that question was coming from. It's about health insurance. And you knew you couldn't solve it, so your brain battered it back with a stock reply. If we ask a follow-up question, which is, tell me more about why you ask. Oh, we discover, our husband's got type 1, they've got all this burden of genetics, and there's a whole story there you weren't aware of, that you only became aware of in the evening. Actually, the heart of her concern is a much bigger picture. And like you say, now you actually, with that knowledge, you actually are able to give us some quite useful perspective, which is that's going to get picked up by the insurance companies anyway. So you might as well do the screening. Like suddenly you've gone from someone who thought they couldn't help to someone who's actually, I've got a bit of an insight on this that's probably going to affect your opinion. So the power of don't assume, ask a follow-up question. Most people, the truth is hidden, and it takes at least another follow-up question to reveal it. And that question is as simple as, where's that coming from? Tell me why you're asking that. What's behind that question? And
I think I like more
most
like
people will tell you.
Tell me why you're asking that question. I think that's easy enough to learn to do. Tell me why you're asking that question before you answer any question.
Yeah.
It's so easy to learn to do, especially when you're in front of 150 of your peers. Tell me why you're asking that question, because that's not the cadence at these meetings. People ask the question and the person on the podium gives the answer.
Yeah.
And then the next person answers the question and you get the answer.
Yeah. It becomes a bit like a pub quiz in those areas where you've just got to bat an answer back.
Yeah. But you're absolutely right. Had I just stopped for a minute and said, tell me why you're asking that question. And that question, and what bugged me personally is that question's come up several times. And I don't have
say that.
I don't have a good toolkit to get to where I really want to get. And you just give it to me. Stop.
Yeah. And you can soften it, Herb. If tell me why you're asking is a bit, can feel a bit brusque, you can soften it by explaining why you want to know. So the words you just said to me would have sounded great in the context of your response. You could have said, do you know what? I get asked this a lot. Tell me why it's important to you. Why are you asking it?
Okay.
That's a much lovelier, softer way of asking that question because you've put context around it.
Okay. All right.
A couple of things that we learned here, Herb. Maybe we can bring it back to the exam room and we'll do another podcast to see how we did.
Yeah, but we're going to do another one about facilitation. But before we get there, I ask you one more question. Because just when you told me what physicians do, that is what we do. We solve. We jump to the solution.
Yeah.
Oh, you got acne? Here, put this cream on your face. Your ankle hurts. You're playing football and your ankle hurts. Yeah. Let's get an x-ray. Put it in a boot. Don't walk on it until I know the x-ray is normal. Okay? That's what we do all day.
Of course, yeah. It's really hard to not do that. Yeah.
But what was really funny, so it was a big dinner and she was at a table with her husband and other pediatricians, and we're having this conversation afterward. And as physicians, this is how warped our head gets. We decided that you can measure the hemoglobin A1C every 3 months. And you can buy these machines and never report it to the insurance company. Do it at home. And then how warped we are. And I said to her, that's equally, if you don't need to know the antibody status. As long as the kid is not hyperglycemic, there's nothing to do. So test them twice a year at home with a machine. It says it's normal. You test again in a year. We solved the problem. But I don't think we addressed their need, which is the fear that our kids are going to have to live with type 1. Kind of a downer. I turned the conversation into a downer.
Yeah. All right. Thank you.
Thank you for your time.
It's been a pleasure. In summary, be curious. You don't have to solve it. Just seek to understand.
Okay, tell me again what that question's come up, or that question comes up often.
That was just putting context around your further inquiry. When I said,
And what I follow it up with.
oh, I get asked that question a lot. Tell me why you're asking that question. What's behind it? Where's it come from? Put it in your own words, Herb. But yeah,
Okay.
you're just putting context around it so that it feels like a bit softer than just a, why are you asking? You know,
All right.
which might feel a bit rude.
I think that's very important.
Yeah.
Thank you for that. That's really.
You're welcome. And these are skills. That's what we do. We're a skills training company, and these are skills, which means they're hard. They take practice. They often feel difficult. Like when you first learned to drive a car, everything felt really difficult. There was a lot to do: feet, hands, eyes. Now you just jump in your car and don't even think about it. Communication skills are the same. When you start doing them, there'll be bits of your brain going, this feels odd. But the more you do it, the more comfortable it becomes, and you become a better communicator. So
thank you.
Give some of the tools a go and see how you get on.
Thank you. Thank you for you. It's always great to see you.
Good to see you guys as well. Thank you so much.
All right. Enjoy the music.
Yeah, will do. Yeah. Enjoy your guitar playing, George. Good to see you. Thanks, both of you.
Thank you.
I'll see you again. Cheers.
Bye. Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.